One second. When you see your ICD-10 CM, so first you are going to see how to code your HIV criteria. Okay. Basically, what do you mean by HIV? Do you know?
Human immunovirus.
Hello.
Immunovirus.
Hello.
Human immunovirus.
Oh, okay. Human immunovirus. AIDS means acquired
Deficiency.
deficiency syndrome. Acquired immunodeficiency, human immunodeficiency syndrome they used to say, right? So that is where basically there is a difference between HIV means it's a virus, AIDS means it's a disease condition, isn't it or not? The virus name which we have given like HIV means, isn't it? So to code this HIV and AIDS, we have two different criteria to be followed. Before that, when we code our HIV, basically you should have a proper lab test report like that report should say clearly that patient is suffering from HIV positive. Either if you code for AIDS nor if you code for HIV positive, you should have a proper that ELISA report, you know, right? That for to test this HIV, they'll do this procedure only, lab analysis like ELISA test. So based upon that only they'll decide the HIV positive or not. Areas, definitely you should have an HIV report result. Got it? So confirmed HIV cases only you have to code. Okay?
Yes, ma'am.
Hello?
Yes, ma'am. Yes, ma'am.
Okay, and based upon symptoms and all you cannot code. Okay, so that is one thing. So first you are going to see what is the code for HIV. Please take your book and just see the code for HIV.
Yes, ma'am.
ICD. Just give me the name.
Please give me time, ma'am.
Yeah, just check it. You know, right, how to go?
Yes, ma'am. I know. B20, ma'am. B20.
Yes, B20. B20 is the code for HIV. One minute. Okay, B20 is the code for HIV. Got it? So
got it.
when you code this, no, basically if you see the patient who is suffering from HIV, they will be suffering from few other disease conditions also, isn't it or not?
Yes, ma'am.
What are all they? So when the person is having HIV now, what is the thing they'll get? Few other drawbacks.
Fever.
Not fever. Basically, the fever is one thing, but basically they'll, their immune power will go off, right? Because of that, they'll get all this air-spreading disease like tuberculosis and many things they'll get, right?
Yes, ma'am.
So that is one criteria. Here, if a patient is coming for, like a patient has been diagnosed with HIV 1 month back itself. Okay, 1 month back itself, patient has been diagnosed with HIV and today he is coming to the hospital for some other disease like tuberculosis. Okay? Today he has come to the hospital saying I'm having severe cough, severe fever and everything, and doctor went for the chest X-ray procedure. They found that patient is having tuberculosis. Okay, and doctor clearly said that this tuberculosis is because of HIV. Okay, means because of that HIV, and HIV is already diagnosed and treatment is going on. Excuse me. But today he has come to the hospital for the some other disease condition only, but that disease condition also is due to HIV. Okay, so now what will you code? Which will be your first code?
Tuberculosis.
Tuberculosis. Why tuberculosis?
Because of who he suffered for this condition.
No, that you should not code. You should code only B20. Why? Because B20, why we have to give it primary? You may ask me a question, madam. Already he has been diagnosed with HIV, but today he is coming for only tuberculosis. But why you are giving B20? Why? Because basically this tuberculosis is also due to HIV only, isn't it or not?
Yes, ma'am.
So that is why we are giving B20 as the primary code and secondary code is your what?
Tuberculosis.
Very good, tuberculosis. That is main thing. And again, you should have a clear report in the medical record. Doctor should say clearly that this HIV is, this tuberculosis is due to HIV only, that he should say. Then you have to code B20 as primary, means HIV primary, and secondary code you will be giving like tuberculosis. The same criteria, ma.
Okay, ma'am.
Okay.
The same criteria. Patient is having a HIV, diagnosis 1 month back itself and treatment is going on. Today patient has come for fracture.
Okay.
Okay.
So which will be a first code and which will be a second code?
B20 is the first code and second cause is
Fracture.
because of the fracture.
Again just make sure what you are saying is correct or not. See today, HIV has been diagnosed 1 month back, but today he is coming for fracture only. How will you code? Which will be your primary code?
Primary cause is HIV, ma'am. First. Next to fracture.
No, wrong. I've clearly told you, right? See, if doctor says, when it comes to fracture, it is nowhere related to HIV.
Fracture is nowhere related to
Tell me once again, ma'am. Bond number.
Fracture becomes first code.
See, tuberculosis, you know, right? Basically, if a patient is having HIV, slowly his immunity power will go off. So, because of that less immunity power, all other air-spreading disease will come like malaria, typhoid, and tuberculosis, all this thing.
Yes, ma'am.
Okay, slowly next disease will come. So when you visit to the doctor for these conditions, the doctor will clearly say that you are suffering from malaria, this is due to HIV. You are suffering from typhoid, this is due to HIV, like that say. But fracture is it related to HIV? Because of HIV, will you get a fracture?
No, ma'am.
No, and doctor then say like fracture is related to HIV. So which will be your primary code here?
Fracture is the primary code.
Primary code. Fracture is the primary code. Basically, when it comes to coding, the reason for visit should be the primary. Today, for what he has come, that should be the primary code. But why we are changing in tuberculosis and HIV? Why we are changing that now? Because the tuberculosis itself is due to HIV. That's why we are giving HIV as a primary code and secondary as tuberculosis. Got it?
Okay.
And when it comes to fracture, today the patient has come for fracture only, a treatment is given for that only. So that is why we are giving fracture as primary and second code is your
HIV.
very good. Got it?
Got it.
Okay, that is where it is. And again, if a patient is having inconclusive HIV report, means the HIV report either it will not be saying like positive nor it will not be saying negative. It will be like in between. Okay, in that criteria, you have to give inconclusive serological report. The code is R65, I suppose. Okay?
Page.
Okay?
Okay.
Page number you can see in your medical coding book itself in the first to fifth page.
R75.
R75, ma'am.
Sorry, R75. Okay?
Yes, ma'am.
Okay. And next is, if a patient is pregnant and if she is having HIV, okay, the first code you should give na O98.7, which says pregnant patient having HIV, okay?
Okay.
Okay, that is where it is. So basically, when a pregnant patient is coming for any disease condition, even though if it is not related to pregnancy also, first code you have to give pregnancy complication. Can you say why? Why? Guys, are you there or not?
Yes,
Yes,
ma'am.
ma'am.
Why you do not know?
Because of HIV, you will not see.
What's your qualification you?
Hello?
Hello?
Yes, ma'am.
Hello?
Ma'am, wait 1 minute, ma'am. I will tell you.
One second. What's your qualification?
Chemistry, ma'am.
Chemistry, okay.
Chemistry.
See, basically, when it comes to pregnancy, if it is, pregnant lady should have gotten fracture or something. So before giving the medication, doctor should take a decision. Why? Because that medication which is given to the patient will also affect the baby, isn't it or not? Fetus.
Yes, ma'am. Yes,
So that is why they should be like very careful. So that is why if the disease condition is nowhere related to pregnancy also, we are giving the first code pregnancy complication code, then we are giving the consent disease condition.
okay, ma'am.
Okay, this is applicable for all.
Okay, ma'am.
So just here also, if a pregnant lady, if she is having HIV now, first you have to give pregnancy complication code, that is 098.7, and second we have to give what type of complication it is or what type of disease it is, which is nothing but HIV B20.
Okay, ma'am.
Okay, and next is when will you code HIV positive code and when will you code AIDS code? The AIDS code is Z21. 21, okay?
Okay, ma'am.
Okay, so here, if a patient is having, okay, if a patient is having HIV positive, guys, I have sent you some questions, no? Why you didn't send me the answers for that?
I will send to today, ma'am. After the completion of the section, I will send that.
What about others?
All are
All
How many are there?
8 members, sir.
So you should have, again, why I have given this? To get used to that book only, right? But if you are not doing that one, again you had 2 days time, your mic was not working, so you would have did this, right?
we already done, but
We already done, madam, but
we didn't send it.
we didn't send out.
But we didn't know that.
Just send it today, na?
Yes, ma'am. Today I
Okay.
will send.
So when will you code HIV and when will you code AIDS? AIDS will be coding like if a patient is having no symptoms of HIV, but that result alone shows HIV positive means we have to code AIDS.
Okay.
Okay, for example, a patient would have come for some injury. Okay, would have admitted in the hospital for injury in the emergency criteria. At the time, the patient would have need blood.
Okay.
Okay, before giving blood, what they will do, they will check the injured patient's blood also, isn't it or not?
Yes, ma'am.
At that time, they found unfortunately that patient is having HIV positive.
Okay.
Okay, and again no symptoms, he is not having any symptom or nothing, he just came for injury alone, but unfortunately he found that he is having HIV positive.
Okay.
So here you have to give AIDS code Z21.
Okay.
Okay, if the patient is having all the symptoms of HIV and the result report also shows HIV positive means, then that comes under B20. Means if patient comes to the hospital saying I have weight loss, this thing, all these symptoms, whatever the patient says, no, it clearly says that patient might have, I have an illegal contact, that, this, I am drug abuse, all this thing they'll say. So basically getting all that symptoms, no, it clearly says patient is having HIV. But still what doctor will do? He'll ask the patient to go for ELISA test. Got it? So if that ELISA test shows HIV positive, then we have to give B20.
Okay.
Okay or not?
Yes, ma'am.
Okay, so that is how we need to code this HIV criteria. So based upon this, I'll send you some descriptions. You just code it and send to me, okay?
Okay, madam. Okay.
Okay, so please don't avoid each and every day. I'll send you some guideline and I'll teach you the guideline and then I'll send you the questions. Make sure you complete your test and go. You complete your course and you just chat me in that Skype itself and then you can move.
Okay, ma'am.
Okay?
Okay.
Okay, I can cut your call. I'll send you now.
Thank you.
Okay.
ఎంత ప్రశాంతంగా ఉంది ఖచ్చితంగా. వాళ్ళు ఎవరు రాసారో చూసి పంపించు. వాళ్ళ దగ్గర చూసి టైప్ చేసి పంపించారు.
పంపిస్తాం.